Number 6. A 41-year-old man presents to the emergency department complaining of the sudden onset of weakness, nausea, vomiting, and blurred vision. On physical examination, he has fixed, dilated pupils and a decreased gag reflex. When asked, he admits that he often eats food that he has canned himself. The patient is admitted to the hospital for further monitoring. What is the most likely diagnosis? Botulism, resulting from ingestion of the botulinum toxin made by the gram-positive spore-forming bacteria Clostridium botulinum. What is the pathophysiology of this toxicity? Acetylcholine is normally released by motor neurons into the neuromuscular junction, where it binds to muscarinic receptors on the motor end plate of the muscle fiber. This binding depolarizes the membrane and subsequently contracts the muscle. Botulinum toxin binds presynaptically and prevents the release of acetylcholine into the neuromuscular junction. The result is a flaccid paralysis or inability to contract. The binding is irreversible, and it takes approximately 6 months for new synapses to form. What is the typical course in adult patients with this condition? Ingestion of the botulinum toxin in food usually causes symptoms within 12 to 36 hours. The first symptoms are gastrointestinal distress, e.g. cramps and nausea, due to enteric nervous system dysfunction, followed by neurologic symptoms. The first nerves affected are the cranial nerves, causing blurred vision, decreased eye movements, and a decreased gag reflex. The paralysis is symmetric and descending. Autonomic nerves can also be affected, resulting in ileus, urinary retention, and orthostatic hypertension. Respiratory muscles can also be affected, necessitating ventilator support. What is the differential diagnosis in this presentation? The major differential includes Guillain-Barré syndrome, myasthenia gravis, and Lambert-Eaton syndrome. Unlike botulism, the paralysis seen in Guillain-Barré syndrome is due to a post-infectious demyelination of alpha motor neurons and is ascending. The most common infection leading to Guillain-Barré syndrome is Campylobacter jejuni. Myasthenia gravis is an autoimmune condition caused by antibodies created against the muscarinic acetylcholine receptor. Patients with this condition have muscle weakness only after prolonged muscle use, classically at the end of the day. Lambert-Eaton syndrome is a paraneoplastic anti-calcium channel antibody syndrome that causes muscle weakness that improves with prolonged muscle use. How can this toxicity be acquired? In adults, it is acquired most commonly from ingestion of preformed toxin in contaminated canned foods, usually home-canned. In infants, ingestion of bacterial spores found in honey can result in toxicity referred to as floppy baby syndrome.